Okay, Victoria, are you going to do some housekeeping stuff?
Yep.
Okay.
And just.
Okay, a couple minutes yet? Okay.
They said this meeting is being recorded, but I could just hit pound.
Hi, can I ask who's just joined us?
This is Dr. Padula. Who is this?
This is Victoria.
Hi, Victoria.
Hi.
They did it right.
Okay, we're going to go ahead and get started just to be mindful of everybody's time. And as people sign in, I will go ahead and keep muting everybody. Good afternoon, and my name is Victoria Lancey, and I'm the Rural Education Manager with the Michigan Center for Rural Health, and will be helping facilitate this program. I would like to welcome to everybody today to today's Oral Health Grand Rounds program on Move Up to Your Mouth, Making Hypertension, Diabetes, and Oral Health Connections. It is brought to you by the Michigan Department of Health and Human Services Oral Health Program and the Michigan Center for Rural Health. Before we begin the program, just a couple of reminders. If you are logged into the webinar portion and have computer speakers, you can listen to the audio through them. If you are listening to the program through the audio number, handouts are located on our website for you to follow along. Our website is www.mcrh.ms.edu. Click up. Click on the education link across the top. Scroll down until you find today's date, and there you will see the attendance forms, the presentation, and the evaluation link. The attendance forms need to be emailed, faxed, or mailed into the Michigan Center for Rural Health office, and the evaluation must be completed online. These forms must be completed within 2 weeks or by June 23rd in order to receive continuing education. There is a continuing education for oral health professionals, nurses, or social workers, and dietitians. If you would like to ask a question during the program, please type it into the chat box so you don't forget it, and the presenters will address it during the Q&A component at the end of the program. Or you can wait and ask it during the Q&A component at the end of the program when we open up all the lines for questions. Our speakers today indicate that there is no conflict of interest, and the planning committee did not have any conflict. There is no commercial support for this program. And with that, I am pleased to introduce one of our speakers, Susan Demings, who is a registered dental hygienist and registered dental assistant, and has been with the Michigan Department of Health and Human Services Oral Health Unit since 2006. With that, take it away, Susan.
Thank you. And I just want to thank the Center for Rural Health for great with the Department of Health and Human Services on presenting these oral health grand rounds. And thank you, Victoria, for being our host today. So just to kind of start off, we wanted to tell you why we are presenting this webcast. We know an estimated 70 million adults in the United States have high blood pressure, and over 29 million have diabetes. In 2013, 34% of Michigan adults were ever told they had hypertension, and in 2014, an estimated 10% of Michigan adults 18 and over were diagnosed with diabetes, including those with prediabetes. We know there are associations with poor oral health and the risk for heart disease. There's strong evidence that people with diabetes have more oral health problems, missing teeth, and that poor oral health is related to an increased risk for diabetes. And dental professionals have an obligation to help patients at risk for hypertension and diabetes, and have the unique opportunity to improve both oral health and general health. So what are we doing? So why are we doing this? We actually started a project with the Michigan Department of Health and Human Services section on cardiovascular health, nutrition, and physical activity to collaborate them with a CDC grant project. We decided with the funds available to assess dental professionals on their knowledge and practices related to screening their patients for hypertension and diabetes. And we know there are connections of poor oral health. Like I said, the heart disease and diabetes and dental settings are a good way to screen people and refer them out for treatment. So in 2016, we sent out a survey to most all dental professionals in the state of Michigan. That included dentists, dental hygienists, and dental assistants, with the help from Delta Dental and Scantron Survey Services and through a SurveyMonkey link. And you'll hear more about those results later in the webcast. So who will we hear from today? Well, today we have a few experts. We have Beth Jabin, who serves as the public health consultant, health systems intervention within the cardiovascular health, nutrition, and physical activity section at the Michigan Department of Health and Human Services. Beth previously served as a supplemental nutrition assistance program education coordinator for Michigan State University Extension. And prior to that, she served as the Director of Community Health Education at Sparrow Health Systems, where she developed and implemented strategies for health improvement in work sites and community settings across Michigan. She completed her bachelor's degree in psychology and holds a master's degree in kinesiology and is currently pursuing a master's in public health administration. After Beth talks about the link with oral health and hypertension, we also have Kim Lombard, who's a registered dietitian and certified diabetes educator. She received her undergraduate degree from Illinois State University and earned a master's in dietetics at Eastern Illinois. Kim is the Diabetes Self-Management Education Training Certification Program Coordinator for MDHHS, and she supports technical assistance to all the 91 DSME programs in the state. And after Kim is done, Kylie's going to give us the results of that survey I was discussing. She's the project evaluator for the Michigan Department of Health and Human Services Heart Disease and Stroke Prevention Unit. Kylie received her Bachelor's of Science from Alma College in 2015 and is currently working on her Master's of Public Health at Michigan State. Kylie was instrumental in pulling together the data and developing the results of the blood pressure diabetes survey to the dental professionals that you'll learn about today. So with that, we had a couple objectives that we wanted to share. We're hoping that you recognize at least 2 connections of heart disease and oral health, and that you can recognize at least 2 management strategies to improve the oral health of people with diabetes, and become familiar with at least 2 of the MDHHS survey results that Kylie's going to talk about in just a minute. So I think with that, I think we're ready for Beth to take it away.
Great. Good afternoon. My short presentation will address the first objective, and that is that participants will be able to recognize at least 2 connections between oral health and heart disease. According to the American Heart Association, heart disease is the leading cause of death for both men and women. 1 of every 4 deaths in the U.S. is attributed to heart disease, and the figures are similar for Michigan. Nationally and in Michigan, 1 in 3 adults has hypertension. Almost half of these people don't have their blood pressure under control. Of those that are not controlled, half don't know their blood pressure is high and are not receiving treatment to control it, placing them at increased risk for heart attack or stroke. It is projected that by 2030, heart disease cases in Michigan will rise from 600,000 to 2.9 million. High blood pressure, LDL cholesterol, and smoking are key heart disease risk factors. According to the American Heart Association, about half of Americans have at least 1 of these 3 risk factors. Other risk factors include family history of heart disease, lack of physical activity, poor dietary choices, being overweight, and having diabetes. While there is no conclusive evidence that preventing gum disease can prevent heart disease or that treating gum disease will lessen atherosclerosis resulting in heart attack or stroke, researchers have found that people with periodontal disease are twice as likely to have heart disease. Several theories may explain the connection between gum disease and heart disease. One theory is that bacteria in the mouth may travel through the bloodstream to the heart and attach to fatty plaques in the vessels feeding the heart. This could contribute to clot formation, which in turn may lead to a heart attack. Another theory points to inflammation associated with gum disease contributing to overall inflammation, which has been implicated in heart disease. Inflammation can also result in endocarditis, an infection of the lining of the heart. It may be that people with gum disease have risk factors that not only put their mouth at risk, but their heart and blood vessels as well. These factors include smoking, poor diet, diabetes, and lack of time and resources to attend to overall healthy habits. It's important to note that in many cases, factors outside the individual's control, such as access to food, adequate housing, and access to health care, exert significant influence on health habits and outcomes. So what's the takeaway? Takeaway is that integrating oral health and primary care is a goal for many healthcare organizations. The oral healthcare setting offers promising opportunities to screen patients for hypertension. In addition, team-based care, including oral health providers, is a key strategy in improving. MDHHS offers resources to support this work. Specifically, the Michigan High Blood Pressure University, which is online, is a compilation of high blood pressure resources for professionals, patients, and community groups. It includes clinical guidelines, training and reference materials, office tools, and educational handouts. High Blood Pressure University offers a cafeteria approach to improving high blood pressure care, so each individual can determine which resources are best suited for their interest and needs. And most of the material can be downloaded and copied free of charge.
And these are some references that Beth had included with this presentation. And this presentation, I believe, will be available to you as well. So Kim, if you are ready to go, just tell me when you want me to change the slides for you.
All right, I am ready.
Go right ahead, go.
There we go. All right, well, good afternoon, everyone. My name is Kim. I am a registered dietitian, certified diabetes educator, and I am addressing the second objective today, and that is to describe 2 impacts of diabetes management on oral health. So next slide, please. Actually, you can go one more, Susan. All right, the detrimental effects of diabetes on oral health have been well documented. And what we also know is that the effects of oral health impact diabetes management. So it is a two-way street. Oral health impacts diabetes, diabetes impacts oral health. People with diabetes have a higher risk for periodontal disease and experience almost 3 times more periodontal pathology than those without diabetes. Diabetes and oral health are 2 of the leading health indicators in the U.S. Next slide. Last year, the Oral Health Program collaborated with the Diabetes and the Epidemiology sections to develop the MDHHS Oral Health and Diabetes Fact Sheet. And what you see here is just a quick screenshot of the first page of that fact sheet. Next slide, please. Some of the facts that you can find on this sheet include that more adults without diabetes visited a dentist in the past year compared to adults with diabetes. Adults with diabetes had a higher percentage of significant tooth loss, which is defined as 6 or more teeth, compared to persons without diabetes, and this was regardless of age. Among adults with diabetes, disparities in tooth loss existed by race and by smoking status. And I would encourage you, if you want a copy of this fact sheet, I'm sure it's located on the oral health page. It is also located at michigan.gov/diabetes. And if you scroll down to the bottom of the page, you will find a link to this fact sheet. Next slide. This is a graph that demonstrates that prevalence of tooth loss. And you can see here that it is definitely, there's significant differences regardless of the age group when you compare people with diabetes to people without diabetes. Next slide. So listed on this slide, you can find the common oral health problems associated with diabetes. And for those oral health professionals, when you have a patient with diabetes and you are seeing multiple of these oral health problems, you can be fairly certain that that patient is not only struggling with their oral care, but struggling also with their glucose control. Again, we're in that vicious cycle. Next slide. So this next slide, this is from the American Diabetes Association, and it's very busy, but it does tell the story of the connection between oral health and diabetes. And as a diabetes educator, I think one of the pieces that stands out most on this slide to me is towards the top in the yellow box, you see that side effects of drugs used to treat diabetes. Obviously, treating diabetes with medications is not typically an option. But then just noticing the ripple effect that those medications have on a patient's oral health is quite amazing. Next slide. Tooth decay is a common problem for those with diabetes. And when diabetes is not well controlled, the high glucose levels in saliva may help the bacteria to thrive in the mouth. So it's likely comparable to having candy in the mouth at all times. So this coupled with dry mouth can lead to tooth decay. Next slide. Gingivitis is another risk for people with diabetes because they're generally more susceptible to bacterial infections. So when diabetes is uncontrolled, that has a negative impact on the body's immune system. And so there is a decreased ability to fight bacteria, and those bacteria that invade the gums then can really present a risk. Next slide. So we mentioned tooth decay and gingivitis, but those with uncontrolled diabetes are more likely to develop serious gum disease as well. Research suggests that as an infectious process with a prominent inflammatory component, periodontal disease can adversely affect the metabolic control of diabetes. And on the flip side, though, the good news is that treatment of this periodontal disease and reduction of that oral inflammation has a positive effect on the diabetes. Next slide. Recent studies show that oral soft tissue disease occurs up to 10 times more frequently in patients with diabetes than in those without diabetes. And as in other oral health conditions, this symptom is more pronounced in those with uncontrolled diabetes. So it's not merely the diagnosis of diabetes that causes these problems. It's when the patient does not have good control of the diabetes that it becomes the bigger issue. Next slide. After periodontal tissue, the oral site most frequently affected in diabetes is the mucosa of the tongue. And in a study of 176 patients with diabetes, atrophy of the tongue was found in 26.9% of patients. And I think it's widely recognized that uncontrolled diabetes can lead to problems with lower limb neuropathy for patients. We hear about the foot ulcers, amputations that occur in patients with uncontrolled diabetes. But I don't know that the connection that these tongue issues actually can be part of that neuropathy as well. I don't think that is as widely known. So again, good blood sugar control for people with diabetes can help to reduce these risks. Next slide. So screening for diabetes. In Healthy People 2020, the U.S. Department of Health and Human Services rates screening for diabetes as one of the top measures that needs to be implemented in our healthcare system. According to CDC statistics, and Susan mentioned this, 29.1 million people in the United States have diabetes. But of this, 8.1 million people have it but do not know that they have it. So it's very difficult to manage something that you don't know exists. So these screenings are very important to help identify those with diabetes that are undiagnosed, to help people with diabetes make the connection of their oral care and their blood glucose control. But also, screening in the dental offices can help identify those people with prediabetes. So prediabetes is a disorder where patients have high blood sugars, not high enough to be diagnosed with diabetes, but higher than normal. And this is reversible. So identifying these folks early can help stem that tide of that increase in diabetes diagnoses. Next slide. I'm actually going to skip this slide. Kylie is going to address this when she speaks. And then Susan, if you could actually go one more slide further. So what can we do? So whether you're an oral health professional or a medical professional, there are things you can do to help your patients improve their diabetes care and therefore improve their oral health care and vice versa. So helping the patients make that connection and educating on the risks of poor oral health and their diabetes control and diabetes control on their oral health. For providers, building relationships between the dental providers and your medical partners, realizing that you're both seeing these same patients. So for the medical partners, it's really no different than getting a consult notification from a cardiologist that you sent a patient to. Having dental professionals and medical professionals opening that line of communication can help with that patient management. And then the third piece is being supportive of education and self-management for people with diabetes. Diabetes self-management education is a service that is covered by all insurance plans. And so adding that piece of education for patients with diabetes to help them understand how to better manage their diabetes can help both with blood sugar and with oral health care. Next slide. So this slide shows you some of the collaborations that are going on. The Tobacco-Free Michigan connecting what happens with smoking and oral health and diabetes. So between the different groups that are working together, this slide will be on the slide deck, obviously, and help you to see who is working, who you can contact. Next slide, please. And this slide, my final slide here, this can give you some resources that you may find useful when you're discussing diabetes and oral health. So there are many out there. And then I believe at the end of the slide deck will also be our contact information. So if you do have any questions, you can contact me directly with questions about diabetes. All right, and I think up next is Kylie.
Thanks, Kim. Hi, I'm Kylie Duda, and I am the project evaluator for the Michigan Department of Health and Human Services Heart Disease and Stroke Prevention Unit. I'm going to be talking to you today a little bit of the results from the Michigan assessment of blood pressure and diabetes screening practices among oral health professionals. So this survey was created by, in collaboration with the Michigan Department of Health and Human Services and Delta Dental of Michigan, Ohio, and Indiana. We created the survey and it was sent out to 4,646 dental practices through a contact list provided by the Delta Dental of Michigan, Ohio, and Indiana. The copies were sent out via the Scantron survey services, and it was also included with a $2 bill incentive. We sent them, in addition by sending them by mail, we also sent them via SurveyMonkey link out to dental professionals through the Dental Professional Association, the Michigan Dental Association, the Michigan Dental Hygienists Association, the Michigan Dental Assistants Association, and also the Michigan Oral Health Coalition. We received back 1,452 from the mailing, which was a 31% response rate from what we had before we sent out. And then we also received 263 surveys from SurveyMonkey, which would brought it to a total of 1,715 responses. However, some of the surveys were returned blank or they were duplicate, so the total number was 1,703 responses. These responses covered 465 different zip codes, and each of those zip codes had a number of respondents ranging from 1 to 23 different responses. In the UP alone, there were over 20 zip codes that were covered. So the first question we asked is, what patients do you screen blood pressure readings for? The majority of the participants reported that they take blood pressure readings for all patients over 18 and older. However, 295 said that they do not take blood pressure readings at all. The other answers included those with history of hypertension, 471, patients who requested it, 327, new patients only, 251, and the majority of the other answers were people that had it prior to surgical procedures. The next question that was asked is, why do you not take blood pressure readings? Of those that did not take blood pressure, the #1 response was actually other. The majority of the other responses were that it was not applicable to their practice because they only see patients under 18 years old, or there was too much patient resistance, or they kept getting too many false readings. Other answers that for not assessing blood pressure, the top one was, I do not see the need to do this, 96. There's too little time in the appointment, 61. No reimbursement or incentive, 57. Their equipment was not available, 48 responses. Or they're uncomfortable with their skills, 26. Or unable to refer for care, only 5 results. The third one was your comfort level taking blood pressure. A majority of the participants were very comfortable or comfortable with taking blood pressure readings. Over 80% were in the at least comfortable range. 63.7% were very comfortable, and 19.1% were comfortable with it. Only 1.3% were uncomfortable taking blood pressure readings, and 5% were very uncomfortable, or 0.5% were very uncomfortable. Only 6.6%, which about 113 people, were neutral on this, and 8.8% did not answer the question. Next we asked, what do you consider normal blood pressure? When asked to consider what they consider normal, 59.5% considered greater than 120 over 80 systolic, and less than or greater than 80 diastolic is normal blood pressure. 33.7 believe that a range of 120 to 139 and 80 to 89 diastolic was the normal range. However, there is still 0.8% of participants that believed 140 to 159 or 90 to 99 diastolic, which is based on the old recommendations of blood pressure readings. Only one person thought that greater than 160 systolic and greater than 100 diastolic was the normal reading, which is a bit concerning. Next gets into our diabetes portion of the survey. Similar to the high blood pressure, we asked which patients do you screen for diabetes. Unlike high blood pressure, the majority of the participants, 898, selected that they do not screen for diabetes, and only 510 said they screened all adults above 18 years or older. Other answers included only patients with history, 254, new patients only, 160, and only patients who requested it, 67.
I think it might be important to interject here too, Kylie, that we asked different ways that they could screen for diabetes too, and that's not indicated in this question. Right. So we know that was a limitation.
Mm-hmm. The next thing that was asked was the comfort level screening for diabetes. Again, you can see there's quite a bit difference between the screening for high blood pressure versus screening for diabetes. The majority, 27.5% of the participants, were neutral when it came to screening for diabetes. 9.7 were uncomfortable, 3.8 were very comfortable, and 22.7 of the participants skipped the question. On the other hand, only 18% were very comfortable, and then 18.3% were comfortable, which is significantly less than what it was for screening for high blood pressure.
But as a dental professional, I'm kind of surprised at that.
So next we asked, if you do not screen for diabetes, please answer why. Of those who selected that they do not screen for diabetes, the majority, 478, said they treat the dental condition and suggest that they should contact their primary provider. The other responses as to why they did not screen included, I consider it out of my scope of practice, 283. I do not have additional equipment needed for follow-up, 195. The oral signs can indicate too many other medical conditions, 122. Or there is no reimbursement or incentive for this procedure, 110. They are unable to refer for care, 10. Or other, 103. The majority of the other responses was that they do not know how to screen for it, or they need additional training, or they do not want to be legally liable for it. Next we asked, which of the following methods do you use to screen for diabetes? When they do screen for diabetes, the majority of the participants use questions on health assessment questionnaire. That was 935, while others, 774, used periodontal screening. However, 334 still do not screen for diabetes at all. Other methods traditionally reported included performing a point of care finger stick for random plasma glucose levels, which was 99, and performing a point of care finger stick for the A1C hemoglobin test, which is only 19. Then we asked them to look at these choices that we give them. What oral signs of elevated blood glucose do you use primarily when you're screening for diabetes? Besides the above mentioned, participants also mentioned that they followed oral signs of elevated blood glucose levels when screening for prediabetes. Gingivitis, bleeding gums, 902, xerostomia or dry mouth, 463, and fungal infections, 446. In addition, 155 did not know what signs to use, and 147 replied other. Of the majority of the other responses included poor healing, acetone, sweet-smelling breath, or medical history. Results referrals. So we also wanted to get a background. We also wanted to get a background with the referrals, if they made any referral process or if there was a referral process. So we asked them to check all options below that they normally do when screening referrals and referring a patient with hypertension, high hemoglobin A1C, or at risk for prediabetes. When screening reveals a patient for these three, they reported that they informed the patient to follow up with their primary care provider. The second most reported answer was providing patient education. Interesting enough, for hypertension, the third most reported response was that their office contacts the patient's primary care provider. However, for the high hemoglobin A1C or the prediabetes, the third most popular response was they do nothing. An answer for doing nothing could be of concern, and it may be benefiting for looking into additional information. Referrals continue. So we then asked, do you perform a follow-up after making referral for high blood pressure or at risk for for diabetes? As you can see in the figure, only 26.1% of oral health professionals perform any type of follow-up for high blood pressure or elevated glucose levels. The majority, 30.9%, only provide follow-up some of the time, and 20.9% do not provide it at all. We then ask those that do make referrals, after referral, who do you follow up with? Of those that provided follow-up, the majority, 805, said that they follow up with the patient, and 126 follow up with providers. 239 follow up with both. Participants reported that most follow-up occurs at the next appointment. However, normally the next appointment is not until 6 months later after the original appointment. We then asked if the oral health professionals had any suggestions for how we could address these issues or bring up education about making referral process or education on taking blood pressure and screening for prediabetes. When asked about suggestions, the receiving educational resources on hypertension, a majority of participants reported that they would like online continued education course opportunities or informational pamphlets and fact sheets. Other recommendations included a reference card on hypertension and diabetes guidance, 845 responses, webinars, 606 responses, or on-site refresher trainings, 308. Only 70 respondents thought no additional resources were needed. And that concludes the results from the survey.
Okay, thanks, guys. I really appreciate you sharing your time today with us. I just wanted to kind of give you an update on what we are doing here at the Michigan Department of Health as our next step. So from this survey, we learned there's a need out there for more education materials. And we also saw a need to maybe develop some guidelines for oral health professionals. So our next step is we are currently working on putting together an advisory team. So October 13th is our advisory team meeting, and so we're going to try to figure out how we can develop these guidelines for oral health professionals. So, and what you want and what you'd like to see, and so if you have any feedback on that you want to share with me before that time, that would be great. Like Kylie said, we are going to be working on developing educational materials that go along with these guidelines to use at chairside for oral health professionals, so you have some idea. So say if a person's blood pressure is kind of high, what the recommendation would be. And then as a last step, we hope to put out another survey to oral health professionals in a couple years just to see if our efforts have paid off and that more oral health professionals are doing hypertension screenings with blood pressure and checking for prediabetes and diabetes. So we can open it up to questions. I think I have a contact page. Here's the contact information page. So if you need to get a hold of us, probably email is the easiest and best way. But these will be available to you, and we will answer any questions.
Do you want to say what they can find in the actual document?
Kylie's recommending if you want to see a summary of the report from the survey, that is available on www.michigan/oral health, I believe. Is it michigan.gov/oral health? Yeah, so we can get that to you as well. But there's a summary made up, a 2-page summary that would be easier to read than the full report. But if you're interested in that, you can contact any one of us and we can certainly get that to you. So Victoria, I think we are ready for questions, if there are any, or what questions do you have?
Okay, so I'm going to unmute the lines for questions, so please bear with me. If you don't have a question, you can always mute yourself back with *6, or you can mute yourself again with the mute button on your screen. So please be mindful that we can hear all your conversations if you are having a sidebar conversation. Okay, so all the lines are unmuted. So if you have a question, please feel free.
Guess we did a good job and there are no questions. Wow, that's... or Victoria?
Yeah, I'm gonna.
Is there any questions in the chat? I can't see them.
Oh, there are.
Hey, well, we won't take any more of your time, so thank you for listening, and please feel free to, yeah, you can contact any one of us with if you do have a question later. So have a good weekend, guys.
And you can always if you have a question, you can always indicate the question on your evaluation, or please feel free to email me directly and I can pass it along to any of the speakers, or you can email them directly as well. Thank you, everybody. If you don't have any questions, thank you and have a great weekend.